بنات.
So this big muscle is the gluteal muscle, is it not? So we call it as gluteus maximus.
Can you show it here, doctor?
I think they remove it here.
هذا okay.
The uppermost will be the gluteus muscle.
So this is the gluteus muscle.
Okay. Gluteus maximus. Then we have here we cannot remove the muscle gluteus maximus, right? Then you can see medius and then
remove the
minimus.
gluteus
Maximus, medius, and then innermost minimus, right?
Okay.
So we call it yes, below. We have to remove the first layer, so I removed that one, maximus. Then you can see. So if you recall, right? We said minimus, medius, and then maximus, right? So if I remove maximus, then you can see medius, then
you can see
minimus.
Okay.
So they are arising from here, right? Then they are getting inserted to the greater trochanter and the gluteal tuberosity, right? We have minimus and then medius, and then to the gluteal tuberosity is attached the maximus.
The blue one, right?
Yeah, the blue one. Okay, minimus, medius, and then this blue is the gluteus maximus. I told you while teaching the attachments in the limbs, right? When I told you, remember? No.
Yeah.
So they're taking arising. So we have minimus, medius, and then maximus. They arise from the gluteal region, and then they get inserted to the anterior side of the greater trochanter, lateral side, and then this big one for the maximus, that is the gluteal tuberosity.
Okay.
So you can identify only maximus I removed, and then minimus.
Minimus or medius?
Medius, sorry. Then minimus is inside, right?
Okay.
Then, what are the other muscles in the gluteal region? We have to identify the piriformis. This big muscle is the piriformis. Okay. So piriformis. How to identify piriformis? Because there are some structures which arise above the piriformis and some structures which leave below the piriformis. Okay. So the superior gluteal vessels and nerve leave above the piriformis. Then inferior gluteal vessels and nerves, and then sciatic nerve. Okay. Then we have nerve to obturator internus, and then pudendal nerve and vessels. All these they leave below the piriformis. So when you see this sciatic nerve emerging from below, then this structure is piriformis. So piriformis is a big muscle. So how where does it come from? It comes from the lower part of sacrum. Okay, like an E-shaped insertion it will have. So it will arise from here, piriformis. Okay, so then it fills this space. Okay, as you can see, it fills this gap, and then it gets inserted to the upper part of the greater trochanter. Okay, so it's filling all this area like this.
Okay.
Okay, like this. It's getting attached to the apex of the greater trochanter. So this is for the piriformis. You got how we have the gluteal muscles here, this area, and then piriformis big muscle coming like this, getting inserted to the apex.
Apex of the.
Then we have.
This is the piriformis.
This is
Where is the minimus? Below this?
This is minimus. We removed maximus, is it not?
This is medius, and then minimus is under it, right?
Maximus, medius, and then minimus. Right?
Below it.
And then the piriformis.
This is piriformis. Maximus, medius, and
Piriformis
then
جنبها
minimus.
متحد.
Right? Then this is piriformis. Then you have obturator internus. Okay.
Which is
and
under
superior
the.
gamellus and inferior gamellus.
Where is the superior and the inferior?
This tricentral tendon we call it as. Okay. This small part is internus. Then superior gamellus, inferior gamellus. This is quadrate femoris. You can look like a quadrilateral muscle, quadrate like this. So this is quadrate. Okay.
I can't really see this as 3 different muscles.
Yeah, because they form together. Okay. You look here. Here. Like look here. Okay. This part. So this is superior gamellus, tendon. Then you have the inferior gamellus. Then obturator internus.
Okay.
Okay.
Yes.
3 together actually. This is one.
شعري.
This is one. This is okay. So then we have the quadrate femoris here. So this is the quadrate femoris. Now this area is also important because there are certain structures which live above the piriformis and then which live below the piriformis. So I told you superior gluteal vessels and nerve, they live above the piriformis. The inferior gluteal, they live below along with the sciatic nerve, and also there is posterior femoral cutaneous nerve which is not shown here. We will try to identify this one. Only thing, biggest nerve which you can see is the sciatic nerve because this area is not dissected. If you dissect this area, we have the cadaver, we'll try to see in the cadavers. Okay?
What is the sciatic nerve?
This big one is the sciatic nerve, dividing at the apex of the popliteal fossa into tibial and common peroneal. We will come to it. We will come to this. Okay? Let us finish this gluteal part, then we will go to this part. Right? So is this clear? Then obturator internus and then two. Yes, listen please. Very important.
Obturator.
Internus and superior gemellus, inferior gemellus.
Okay.
Then we identified the
We said
quadrate
the-
femoris,
which is
right?
under them, yeah.
Then we will come to the posterior thigh muscles or the hamstring muscles, which we call them. All of them, they take origin from the ischial tuberosity. They take origin from here, is it? From the ischial tuberosity. This is ischial tuberosity. They take origin from here, right? So then we have biceps going to the fibula, then semitendinosus and semimembranosus. Yes, semimembranosus going to this condyle.
Doctor, can you show us on the other part so it's more clear? Here?
Here. Okay. So this is the origin for hamstring muscles.
Hamstring muscles, yes.
So we have two groups here. Okay. This down. Let us keep
What
it
is
like
the
this.
origin of hamstring? What is it?
Ischial tuberosity. Ischial tuberosity, right? So biceps we have. I'll show you here itself. We have on the lateral side. Identify the lateral side. So this will be the biceps femoris muscle. Then semitendinosus. Okay. Semitendinosus like a. You will feel the tendon. And then semimembranosus where the
Which is under the
semitendinosus and then semimembranosus. Both of them are on the medial side. The biceps is on the lateral side. Okay. And then adductor magnus, I already showed you. The ischial part of the adductor magnus is also a part of the hamstring muscle. Right? D.
مو طالعين بنات ترى.
Then here you can see the sciatic nerve. All this area is supplied by the sciatic nerve, which will divide at the apex of the popliteal fossa into common peroneal nerve and tibial nerve. Okay. So if you look at the popliteal fossa, next is the popliteal fossa. So what are the boundaries of the popliteal fossa? Laterally biceps femoris, medially semitendinosus and semimembranosus. Then again medially lower down, medial head of gastrocnemius. Laterally, lateral head of gastrocnemius. So this forms a fossa which is called as the popliteal fossa. So here you can see most superficially that is the nerve, the sciatic nerve dividing into tibial and common peroneal nerve. Then you have the popliteal vein and artery. Okay, so you see this is vein and this is artery, right? Two structures you can see, popliteal vein and artery. There is also a cutaneous nerve here which is not shown, maybe it is destroyed, right? Posterior femoral cutaneous nerve of the thigh. Okay, so this we call it as posterior femoral cutaneous nerve of the thigh, also in the popliteal fossa. Right?
What is this called?
Posterior femoral cutaneous nerve.
Are you going to ask us about these which are cuts and they're not really obvious?
Difficult to label.
What is the lateral
Okay.
cutaneous?
So it's difficult
Lateral
to label.
femoral is on the lateral side. Lateral femoral. We are on
شيء
posterior
اللي كانت
side.
مقطعة.
So lateral femoral will be here. Lateral femoral. And this important structure is the iliotibial tract, right?
Iliotibial.
This fascia which is thickened on the lateral side, on this side which we call it as iliotibial tract.
Tract.
Tensor fascia lata or iliotibial.
It's the same. Tensor fascialis. Okay.
Then finish with this group. Then we will go to the leg. Right?
جوالي طفلي من جنب.
Tibialis anterior extensor digitorum longus.
من جنب اضغط على لا تحته. ايوه اضغط. خلاص شكرا.
So far clear?
مرة الصوت عالي.
Yes. Then we will go to the this group, right?
You will go to the legs now?
Leg. Right?
Okay.
So first muscle to identify will be which muscle here? On the leg, anterior compartment.
Anterior.
Yes. This is tibia. Where is tibia? Yeah. This is the tibia, right?
Tibia.
So tibialis anterior. Right?
Its name is tibialis anterior.
This one. This tendon is for tibialis anterior.
Which tendon?
This tendon. You can come here to look. This tendon is for tibialis anterior.
Okay.
Right? Then we have.
Which is this one?
Yeah.
Tibialis
Tibialis anterior.
Anterior.
Right?
anterior.
Then we have extensor hallucis longus.
Where?
This tendon.
Okay.
What is the muscle?
This muscle is very closely attached because it is artificial here. Okay. Then extensor digitorum longus for these 4 tendons, and this one for the peroneus tertius.
What?
Peroneus tertius.
Peroneus tertius.
Then on the lateral side you have 2 muscles, peroneus longus and peroneus brevis.
Where is the longest and where is this?
2 muscles are longus. Okay. Brevis will get inserted only here. Okay.
It's not.
Longus will go behind.
Okay.
2 tendons together, longus and then brevis.
So,
Then
doctor,
on
can
the
you,
posterior side,
doctor, can you say that again? Which one is the longest and which is?
yeah, or we will try to see in this way if you can identify in here. Yeah, this one immediate is tibialis anterior. Okay. Then extensor hallucis longus for this tendon. Okay. Then extensor digitorum longus. Okay. 1, 2, 3, 4.
Yeah.
Then peroneus tertius.
Peroneus.
Tertius.
Ah, this one.
Small from here.
Okay.
Okay.
What is the action of peroneal?
Tertius.
You were sure.
And doctor, this is the longest and this
All
is.
of them they cause dorsiflexion. This will we will talk about actions later on, right? Yes. Then you have peroneus longus and then peroneus brevis. Okay. 2.
Okay, so this is the tendon of these of the longest and the brevis, or is it something else?
Brevis will get stop here.
Oh, okay.
Longus.
This is the longest one.
Then if we move behind, now this one for the 2 gastrocnemius, right? Medial and lateral head. Medial head of gastrocnemius, lateral head of gastrocnemius. Gastrocnemius.
Gastrocnemius. بنات شوفوا المصل هذه واضحة هنا في ال pastinated part. Gastrocnemius.
Where is
أي
the
طلع. والله مرة لساني التوى.
هنا.
ايوه والله والله اسوي كذا ابسط ملابسي صح كل مسكتها
عشان كذا المرة الجاية لما نمسك الأشياء هذه ناخذ دور.
This model is not good. There is another one along with this now this part you see, this is gastrocnemius and this is soleus. This muscle is soleus.
Soleus.
Okay. So gastrocnemius and soleus together we call it as triceps surae. Triceps surae. Surae. S-U-R-A-E.
So this is for the triceps. Sorry.
So together with this bulk we call it as triceps surae, and they form a big tendon which is called as Achilles tendon or tendocalcaneus.
Okay.
Tendocalcaneus or Achilles tendon.
Calcaneus.
So it will form a big tendon and get inserted to the calcaneus, right? Then among the deep muscles, what do you have? The deeper most, okay? You have the flexor hallucis longus and flexor digitorum longus, and then this deeper most is the tibialis posterior.
So doctor, this is
Hallucis longus,
and this is.
digitorum longus, and this one tibialis posterior.
Okay.
Right? So this is for the deep group, gastrocnemius, and then this deeper most in the popliteal fossa is the popliteus muscle.
Popliteus muscle.
Right?
Okay.
One more deep muscle is the popliteal
Popliteus
muscle. Right?
Yep.
So along with the lateral head of gastrocnemius, you will have a small muscle which we call it as plantaris.
Plantaris.
Okay, you heard about plantaris. Also, it will also come from the lateral side. Small, it's very small. So medial head, lateral head, and then the plantaris. Okay, Okay, but only gastrocnemius and soleus will form the triceps surae. This area, these muscles together, we call it as the peripheral heart.
peripheral heart.
Why?
عشان blood. It contains blood.
Compress the blood,
Yeah.
is it not? And these muscles have rich sinusoids. That's why if you stand for a long time, what happens? The muscles will, the blood will get collected in the sinusoid, and you feel that your legs are heavy. So these
Is
muscles.
it when you sit for long or when you stand?
Prolonged sitting or prolonged standing, whatever. Okay, that's why to increase the venous return, they ask us to raise our legs, right? Put a pillow, raise your leg, and sleep. Why do they ask for? Get back the venous flow, right? So this is it.
Anything
Now, we have more. We have to go to the soul.